just, I know folks are actively joining, so Wes, who's going to let folks in, or Heidi? Yeah.
I'll continue. Yes.
Yeah. Um, all right. Well, let's go ahead and dive in. We have a packed agenda. Good morning, everyone. I'm Shrila Sharma. I'm one of the backbone co-leads of the Health Equity well, I still want to call it the Health Equity Collective, but it's Coalition for Connected Care, and I'm joined by Heidi McPherson. Heidi, do you want to say hello?
Good morning, everybody. Welcome. Great to see you all in a virtual space.
Yes. If you want to go to the next slide. Oh, Wes, we lost the slides.
One moment, sorry.
That's okay. Well, the next slide really was the agenda. So we have a busy morning. Thank you for spending your Monday morning with us. We know that that's a busy time. We have Dr. Rishi Manchanda from Health Begins, who's joined us along with his colleague, Sadhna Tevaraja. And then, sorry, Wes, can you go back? I'll let you know, Wes, when to transition. And then we have our work group updates that we will do, followed by a discussion that we really want to have with the group on our coalition charter revision. And then we'll wrap up with upcoming events and activities and announcements. So, and feel free to drop in as you're joining the organization that you're joining from, as well as any announcements that you may have. So if you're joining for the Coalition for Connected Care quarterly meeting, you're in the right virtual room. Our vision is health equity for all Greater Houston area residents, and our mission is to establish an impactful, collective, sustainable, data-driven system to promote health equity. Next slide. While I still want to call it the Health Equity Collective, which was our name for a long time, we've transitioned to a new name, Coalition for Connected Care. While our look and name has changed, our vision and mission has stayed the same, which is also to drive better health together. And a lot of the information can be found on our website. If you're new to the coalition, we strongly encourage you to join the website, join us, go to the website. There's a link there for you to join us formally, as well as join many of the work groups that you'll hear from today. Next slide. Just as a reminder, we are a systems coalition to improve care coordination for non-medical drivers of health services in the Greater Houston region. We are 7 years old at this point, almost 7 years old. And we've grown substantially over the past year as well. We have over 385 organizations with over 50 coalitions represented in our coalition, and 1,500 different unique members that are part of the coalition. Primarily, and you see the membership distribution on the very right in the pie chart, primarily healthcare, community organizations, and then a sprinkling of government, philanthropy, academic institutions, and so on. We are a multi-sector collective impact effort, and what you see in the middle are the 5 salient coalition capacities that our work supports. So improving our knowledge around non-medical drivers of skills, promoting acquisition of new skills in these spaces, building organizational linkages, and really thinking about policy and practice efforts in this space. And you'll see all of the work that's going on. Very excited to share all of those updates with you guys today. And we have the privilege at UT Health Houston School of Public Health. There's a little bit, if y'all don't mind just muting yourself if you're not speaking. Thank you. At the UT Health Houston School of Public Health Center for Healthy Communities, we have the privilege of serving as the backbone organization of the coalition. Next slide. And this is our framework of driving better health together. Collective impact is an interesting evidence-based model where essentially we are coming together as organizations because each of us have our respective organizational priorities. But the beauty of the work in the coalition is that we actually have the opportunity to come together to create a common agenda around various non-medical drivers of health. So what you see here in the framework here, the living conditions. And then our common agenda allows us to then create shared measurement, mutually reinforcing activities, continuous communication to build trust. And then our role as the backbone organization is really to support all of this work that's happening in the coalition across the different actions of health and using a community-driven approach. So we have a community voice work group that you'll hear from, but the goal of that community voice work group is really to help drive community engaged action in this space. And all our actions for health that happen in the coalition reside within the 4 buckets that you see at the top, which is health and social services coordination, cross-sector programs and interventions, advocacy practice and policy change, research evaluation, and learning. And we're very excited that each of the work groups really travel across these different actions for health in building out the shared agenda and the activities that we work on together. So with that, next slide. Just want to also share a little bit about the Center for Healthy Communities. We are the backbone organization of the Health Equity Collective. Our vision at the center is healthy people across flourishing communities. Heidi and I are both at UT Health Houston, and the coalition sits very squarely within our infrastructure layer of the work that we do in the center. This is a research center, but our research is driven primarily by what is happening in the community, informed by the community, and also designed by the community and in partnership with many of you. And the coalition efforts really are that core infrastructure piece that drive a lot of the work that we do. If you want to learn more about the work that we do in the center, we've included a QR code here. Heidi, anything you want to share before we jump to Dr. Manchanda?
I would just say, so exciting to see so many of you here this morning. Thank you for joining us. And I so appreciate the ability here of when we reflect back on our framework of connecting the dots across what are the ways that we create the change in our communities that we want to see. And with that, I'll pass it to Dr. Manchanda.
All right. Well, it gives me great pleasure, actually, Wes, if you don't mind stopping your screen share, because Dr. Manchanda will share his screen. I just want to take a moment to introduce both Dr. Manchanda and Sadhna Tevaraja, who both joined us today from Health Begins. A quick introduction: Dr. Manchanda is CEO at Health Begins. He's a physician and also trained in public health. He has advanced bold strategies to help healthcare move upstream and advance health equity for historically marginalized patients and communities through his career as a physician, executive, and public health champion. I think we've all seen his TED Talk, which is absolutely foundational to the work that we have done in the coalition. Dr. Manchanda serves as the founding director of social medicine for a network of community health centers in South Central Los Angeles, as the first lead primary care physician for homeless veterans, at the Greater Los Angeles VA and as the inaugural Chief Medical Officer for a self-insured employer with a large rural agricultural workforce. In his book, The Upstream Doctors, as well as the TED Talk, he introduced upstreamists, I love that, a new model for healthcare professionals who improve outcomes by addressing the social and structural drivers of health equity, which are patients' social needs, community level social determinants of health, and structural determinants of health equity, including structural racism. Welcome, Dr. Manchanda. We are also joined by Sadhna Tevaraja, who is a managing director at Health Begins. She has spent over 10 years at the intersection of health law, policy, and stakeholder engagement. Her cross-sector experience brings a broad, system-wide perspective to her work, improving health outcomes. She led the first External Affairs Department at the USC Schaefer Center for Health Policy and Economics, built business development for a tech startup, and shaped patient programs at the American Cancer Society. Previously, she served in the Obama administration, both in the office of the Health and Human Services Secretary, as well as the White House during the passage and early implementation of the Affordable Care Act. Ms. Tevaraja holds a law degree from Washington University School of Law in St. Louis and a public health degree from Johns Hopkins University. Thank you both so much for joining us. So with no further delay, I'll pass it to you, Dr. Manchanda.
Dr. Sharma, thank you. Thanks to all of you. Thanks, Heidi, as well. Thanks to everybody in the Coalition for Connected Care. I just put this in the chat. The reason that I'm particularly honored is because I spent formative years growing up in Houston. Went to Kennedy Elementary in the Alief School District, if anybody knows that kind of area, just off of Derry Ashford. So I'm hoping at the very least I earned some street cred with everybody here in Houston. And it's a real joy and honor to kind of join you, not only because of that experience growing up, but because of what I've learned about and I'm a fan of when it comes to the work that you guys are leading here. So let me go ahead and share a screen. I'll be here with you for a little bit before I have to head out and drop my son off at school. And I'll see if I can rejoin, but my colleague Sadhana is here as well. And I'm glad we get to spend some time with you. So let me share a screen and show you some of my slides for my remarks, which the bottom line up front is I think there are many concrete opportunities at this point to take action together to build on the incredible strength and the trust and the achievements that you've had in the coalition. And there are concrete opportunities to both unlock and align financing, as well as power to improve the conditions that put people in harm's way. I'm going to focus on the latter part, opportunities to align and unlock power to shape policy, to really respond to shared threats right now that many are facing. And if there's interest, I'm happy to talk about the financing part as well. Health Begins is an organization I founded in 2012. It's been full-time since 2017 when Sadhana joined. And we've had the privilege of working across the country with thousands of individuals now, hundreds of organizations, both in healthcare, the social service sector, as well as public health, to be able to move upstream. And for us, moving upstream, it's an often used phrase, but for us, it means something very specific, which is to reduce harm and improve the social and structural arrangements that put people in harm's way. Let me just repeat that to let it kind of sink in, because it is a foundational approach to everything that we do. It's rooted, as many of you know, in deep traditions, not only of public health, but also of social medicine, traditions that in Western medicine go back a couple of centuries. These are approaches and disciplines and experiences that have long understood that it's important not just to situate healthcare within the broader public health agenda, but to see how healthcare and public health themselves are informed by the way in which power and justice are distributed in society. So how do we reduce harm and improve the social and structural arrangements that put people in harm's way? It's in that context then that I share with you something I'm very proud of, which is that we've had the opportunity since 2012 to work across a number of states in the US to work alongside and equip leaders and teams to reduce the harms that result from injustice. These include the harms that are manifest in people's lives through health inequities. These include the harms of unmet social needs. but there are also the harms, of course, of poverty and dispossession. And then finally, an element that I wanted to raise up here, because it's always been part of our work, is that we've worked to reduce not only the harms of material impacts on people's lives, whether they be patients or clients or residents, but also the harms of moral injury, especially for those in the services industry, whether it's healthcare or social services or public health. There's a lot of professionals who have experienced moral injury and experience it in different times and different eras. And what we've noted is in the past 18 months, the rate of moral injury that we're seeing is spiking. There are more and more professionals, in, including those who are not formal leaders in institutions, as well as those who are leaders in institutions in healthcare and public health and the social sector who are experiencing an acute form of moral injury. And as you guys all know, moral injury is not burnout. Moral injury is the spiritual and psychological wound that forms when working in the face of resource constraints or policy decisions or conditions that force you to betray your own values or make you feel like you have no choice but to work in a space that in which your reality and your values are disconnected. Anybody here experiencing or know somebody? How about this? Anybody just using emojis? Anybody know anybody who might be experiencing moral injury? It doesn't have to be you, but just somebody, a colleague, a professional, someone who's experienced moral injury. You can give me some emojis if you don't mind. If you know someone who might be experiencing moral injury or at least moral distress, which is one step before moral injury. Great.
You're getting a lot of emojis.
Great. So with that in mind, understanding these harms, including but not limited to, of course, the harms of the caregivers and the systems and the leaders in the systems themselves of moral injury, let me say that's why I'm a fan. You can see I just copied and pasted your own collective framework here for the collective's work, now the coalition's work as well. It's one that looks at upstream factors moving from left to right, or right to left, I should say. It's one that is deeply understands a multi-level framework, and it's one that looks, of course, across different dimensions of living conditions as well as the kind of environment, the advocacy and policy environment that we're in right now. And it's worth celebrating, right? That for the past 7 years, is it? Right, since 2019, you've come together to take this framework and turn it into reality through a lot of relationships, a lot of trust, a lot of different phases of what's happened, not just in the growth of your institution, but what's happening in the country. You started, it sounds like, right before the pandemic, and navigated a pandemic to come together. There's a remarkable amount of achievement here. And I know in prior conversations, Sadhana and our colleague Natasha has spoken with a couple of you as well to see how much this assessment of the current state that we've done with when it comes to multi-sector place-based collaboratives such as the coalition's work, to see how much this resonates. And I imagine this resonates with many of you. Many collaboratives across the country who have come together around a multi-level framework and upstream and understanding to improve continuity of services, to improve coordination of care, have really focused for the past decade on, rightly so, how to establish referral networks and how to co-locate services, how to set up the infrastructure of shared data agreements, et cetera. Many folks are now, many, not all, but many collaboratives are also building on that layer of trust and service continuity to align advocacy, to think about how to further elevate community voice, think about how to coordinate to be able to address legislative kind of opportunities or barriers, and then even go further, right, to build power and to be able to influence the upstream conditions that put people in harm's way. I know that your coalition is likely at different places along this continuum, right? Some elements are probably more developed than others, but in general, what I'm sharing with you is that we are a fan of your work because we see you guys at the forefront, frankly, compared to a lot of other collaboratives when it comes to not just what's on the left-hand side of the screen, but even now moving towards the middle and the right-hand side of the screen compared to peers that we see across the country. That's important because when we think about our work at Health Begins, where we do a lot of work in integration, which is the work that you guys are doing as well to help integrate health and social support systems. When we think about our practice areas of investments, where we think about how to help folks unlock and align financing and capital flows to be able to ensure that the funds get to the people and places and the programs that need them most. And then finally, when we think about our work, building power and improving policy, um, we see kindred spirits in many of you, and of course, in this infrastructure that you created together. It's with those three practice areas that I want to share with you what I gather are some of the challenges based on some brief conversations I've had with some of you right now to understand where in integration investments and policy and power, where there's some challenges. Again, this is something that may resonate with all of you because it's something that I think is common for a lot of collaboratives in this moment. Despite broad engagement and achievements, the care coordination ecosystem remains somewhat siloed, right? Systems still work in the incentive infrastructure that exists right now, which keeps people in different silos rather than working in an integrated system. So there's still fragmentation. That's the integration challenge. When it comes to investments, well, sustainability is still a major issue, right? How do you move from a primarily grant-funded type of revenue model into ones that are more sustainable, especially in this moment when so many federal actions have actually led to deep concern about the funding environment for those of both healthcare and social services, and of course, public health. And last but not least, what does this mean for morale in this moment? It's no shock to anybody here that the political and funding climate over the past 18 months has been demoralizing, and that staff across all member organizations, I imagine, are probably feeling stretched thin. Again, these are things that are contributing not just to burnout, perhaps, but also to moral injury. Any of this resonate? Again, emojis here. I'm gonna look for, do these current challenges seem to be correct assessments? See some stuff in the chat. Great. And because I'm sharing screen, as you guys know, I'm just going to use the chat briefly, but if anybody wants to voice over, just Srila or Heidi or Sadhana, if you want to just let me know what kind of engagement we're seeing in the chat for alignment here, let me know.
Yeah, there's tons of emojis going up.
All right, that's what I'm aiming for. All right. So, we can go in different directions over here. Let me just focus in my last few minutes on this particular element. And I'm happy to come back to the other two areas because, again, we have a lot of deep experience and expertise. Happy to draw from lessons learned as well as current opportunities in the first two areas. But let me focus in on the morale and momentum. Because in this moment, I think there are really some concrete strategies and skills to overcome shared threats. And it requires more now than ever collaborative action. The incredible news, the great news, is that you've already developed a lot of the infrastructure for collaborative action in your coalition. Because a lot of folks across the country, perhaps you as well, are asking some version of this question. How can we respond to actions that are creating uncertainty, suffering, and harm, especially in the communities that we live in, and that we're a part of, and that we serve, as well as moral injury? After a lot of deep listening over the years, not just in the past 18 months, but because of our work, and our mission to reduce harm and the arrangements that put people in harm's way, a lot of engagement with those not just in the health and healthcare space and the social sector, but also those in the democracy space, organizations that think about movement building, that think about democracy, scholars of political science, and others. What we've come to conclude is that the answer squarely is this. It must be this. Health professionals, institutions, and place-based collaboratives need to build solidarity within a pro-democracy movement. Because we understand that the threats that we're seeing right now in a variety of different ways are not just representative of shifts in the policy environment. Shifts in policy is something that we're all familiar with as professionals and institutional leaders. What we recognize is that there's altogether a different set of ways to characterize the threats that we're seeing right now, which is to the integrity, not just of vulnerable communities, but to the integrity of the institutions that serve them. When there are threats to the integrity of institutions in civil society, including in health, including in law, including in the social sector, including in public health, including in healthcare, when you see a shared set of threats to the integrity of the institutions in democracy, that should tell us that there's a different way that we need to understand this, and therefore a different solution. Because we know when conversations with our friends at Protect Democracy, for example, which is another wonderful organization that has been bringing a political science perspective to bear to understand this moment. We know that there are common attributes of successful democracy movements. This is borne out not just in US history, but across the world, in current and contemporary examples, as well as in history. And there's a variety of attributes of successful democracy movements. All of these attributes are things that are attributes that are experienced by individuals living in our society, not just playing the role of individual citizen, individual professional who might be after hours going out and participating in some form of what you see here, of thinking about how to manage constructive tensions, but also in our roles as leaders within institutions, as staff within institutions. Every successful democracy movement has always engaged all of us to to think about how in each of our roles in our lives we can play a part. And so with that in mind, there are some concrete skills and strategies that we've found to not just help us within our institutions to promote health and democracy, but also to build solidarity and to move from moral injury to agency. Because moral injury is not a personal failure, it's a sign of systemic failure. And so it requires collaborative action here. And our contributions through a lot of hard work, especially that Sadhana and Natasha and team have led, is to build health professional skills in order to build solidarity with each other and with pro-democracy and health justice movements and organizational strategies. Individual agency and institutional power, skills and strategies are ways in which we can help to promote and protect robust local ecosystems for health and democracy. You may not have viewed the Health Equity Collective, now called the Coalition for Connected Care, as a vital part of an ecosystem for health and democracy, but you are. Collaboratives that have long focused initially in their outset at coordinating services for healthcare and social services, for example, and making sure that people don't fall through the cracks between the institutions that serve them, are a vital part, are on the journey to actually not just promoting community resilience and belonging, to investing in collective infrastructure, but also in actually building the collaborative infrastructure we need to be able to promote egalitarian, equitable policies, and to make sure that our ecosystem of health and democracy is working for everybody. That is what collaborative work looks like. And for us, just let me focus on opportunities that we're seeing across the country soon. This summer, we're launching a national initiative to help place-based multi-sector collaboratives in the states you see highlighted in green here, including in Texas, to come together to apply concrete skills and strategies to protect health and democracy. Those skills and strategies I showed on the screen. And I'll give you an example of the concrete strategies in a second. Texas is absolutely on the map. And if there's interest in this coalition to learn a bit more about ways in which we can support you, in which you can get support from others, and ways to be able to bring your expertise and wisdom to this chapter of the work in the nation, please let us know. This is a concrete opportunity. And here's an example of what those, I'll draw from something we did in Georgia just recently, as you can see, which is another place on the map, of what it looks like to actually start to not just build competencies, but also to build organizational strategies, institutional strategies. I'm going to focus on this in my last few minutes here just to paint a concrete picture of this. The 5 institutional strategies for collaborative action, again, beyond skills we develop as individuals, but ways in which we apply those skills in collaborative action include risk sharing strategies, resource sharing strategies in which we pool financial, human, and material assets, response coordination strategies that help us to provide rapid and sustained responses while ensuring continuity of services, rights protection, and reimagining policy and power to transform the policy and power structures towards health justice. And each of these actually come with a set of concrete strategies. And I'll give you an example of just looking at response coordination. This is an exercise that a group of about 10 different multi-sector collaboratives in Georgia themselves just went through about 3 weeks ago. Similar experiences building collective infrastructure, looking at service continuity, and then thinking about where they could grow next. And what they did was to look at response coordination, understand that response coordination is the difference between reactive scrambling and strategic action, understood this in a more concrete sense, and then started to go through an exercise to assess their current state, to think about what shared threats they're experiencing over the past year, to think about their current strengths that they have, and then to think about the biggest gaps and challenges. And after doing that assessment, they then went on to review and select a variety of strategies to improve coordination of responses, whether it's building rapid response infrastructure, coordinating service continuity, aligning communications and messaging, and/or sustaining long-term campaigns. When they went through and literally as a group set their tables, checked different boxes on what they thought would be helpful ways to address their gaps and build on their strengths, they then prioritized. They identified a couple of strategies, each of their tables, each of their groups that they thought were the highest priority, and then used certain questions to guide their discussions, including the last question on the screen here, which is what are the first 3 action steps that we can take in the next 90 days to be able to build on our strengths to improve response coordination. And this is just one of the R's, response coordination. In this moment, and if people want, I'm happy to go into the financing part, but I think I'll end here and just say that in this moment, a lot of folks, when it comes to the morale momentum piece in particular, are feeling that there's a lot at risk. They're feeling across the country that the work that we've been doing to improve coordination and continuity of services right now is not just being eroded actively, but is actually putting us at greater risk of moral injury, which is the last thing that we have. We can't squander our own kind of morale in this moment. And in terms of how to move from moral injury to agency, I'd leave you with this, which is a poem from Anais Nin, popular poet, some of you may know. It's a very short poem. It's titled Risk. And here it is. And then the day came when the risk to remain tight in a bud became more painful than the risk to blossom. If you're thinking about how to build morale and momentum, know that you're not alone. There are a lot of folks out there who are navigating this question of risk, wondering about whether we can continue and how long we can remain tight in a bud in reaction to shared threats. But just know that at some point, and you may be at this tipping point individually, collectively, the risk to remain tight in that bud might become more painful than the risk to actually blossom. And there are concrete skills and concrete strategies to be able to blossom. When you're ready, let us know.
Thank you, Dr. Munchan. That was fantastic. As you and so many of us agree. I know you have to drop off, but if there are any, I know Sadhna is going to stay on with us for a little. Thank you so much, Dr. Munchan.
Yeah, I can stay on for 5 minutes before my.
Okay.
Yep.
Maybe we can open it up for questions or comments for both Dr. Munchan and Sadhna.
And maybe while you folks like unmute or raise your hands, however you want to participate, I just wanted to mention, I know Rishi, you couldn't see the emojis, but especially when the slide about building solidarity with the pro-democracy movement was up, there were a lot of emojis that cascaded through, and wanted to make sure folks saw what was in the chat, which is really beautiful as well. I saw immediately Kara thinking about connections to other groups that are doing democracy work, and Heidi's response that, that connection is happening. So that was beautiful to see, as well as some of the other comments. So welcome questions, but also wanted to draw attention to those 2 things.
Thanks, Sadhna.
I just want to say thank you for such a fantastic presentation. Everything that you talked about is so timely and relevant. And my passion project is working to reduce social and political polarization. So this is right up my alley. I wanted to first ask about contact information, but that's just a logistic thing that can be handled. I was wondering, what is the role of understanding kind of the mindset of people who are against, the kind of work that you are talking about, and who are for the reduction in funding that we have seen? What is the role of like getting into their headspace and understanding how they're seeing it in terms of executing on the various competencies and framework that you were sharing with us?
June, is it? June, thank you. Appreciate it. I'll put my email in the chat, and Sal, then maybe you can drop some contact information in as well, if you don't mind. June, I really appreciate the question. Many thoughts, but I'll just share one, and happy to follow up in conversation with you and others, because this is actually part of the work, and as Sal will probably speak to later on. There are 7 competencies that we talk through, and build. Some of them actually relate directly to this question about actually how to engage with folks from a community organizing perspective, relational perspective, moral and ethical leadership perspective. There's different ways to get to this. Let me give you my one thought. I shared that from the get-go, Health Begins was founded to reduce harm and to address the conditions that put people in harm's way. Harm is something that we can all relate with, right? Individually, intellectually, right? Professionally, certainly. And there are harms. When we talk about harm, then each of us can engage in conversation about what are the harms that most impact you or that impact groups of us. The harms of, we can use a language, harms of health inequities. If somebody doesn't come to that language, then what are the harms of losing your job? What are the harms of having SNAP benefits taken away? What are the harms of no longer having insurance? What are the harms of gas prices going? There's folks who use this question of harms as a way to be able to understand in a meaningful way, like in a relational way, understand people, understand each other, and bring ourselves into the conversation. So we're not bringing this professional hat of right analysis. Harm is something that I believe is one of the most powerful frames to enter, because then we can start talking about healing. And for those who may have different opinions, ideologies, or have voted one way or another, or have a different set of beliefs, I think it's important that we, as you rightly know, and we all know, these kind of definitions, these kind of affiliations evolve and change. They're dynamic, and there's no broad brush we can paint, whether it's in Houston, right, or any other community in the U.S. There's so many different people with diverse, different kind of experiences. Harm allows us, regardless of the affiliations we have, or the tribal kind of beliefs that we have, or and especially now in this more and more polarized kind of moment, to, I think, cut through and then say, well, let's talk about harms. Let's connect around those harms that we may share, and let's talk about then how we can reduce the harms that are putting people in harm's way, including us in harm's way. That's a key shift, because instead of talking about how you might be subjecting me to harm, or how I'm a threat to you and causing you harm, it's a way to come together to understand that there are things that are putting us in harm's way. I think finding that's been a powerful narrative, at least engaging in healthcare and public health, not just with professionals, but also, frankly, with patients and in communities, with policymakers as well. And there's something that it opens up a little bit more. There's a little bit more blossoming that happens, rather than the tightness in a bud in that conversation. So that's a strategic message, or a narrative frame, if you will, using Stratcom's language, June, that comes to mind. But I'm happy to share more. We found really powerful resonance talking about that.
Thank you. Other questions? Just feel free to come off mute.
I have a question. In the work you're doing with other regions, as you've been diving into these pillars of work and learning, what would you say, like, as you leave us, maybe what have been some of the bright spots of the other collaborative efforts in coming together around these positions?
Shared experience, shared language, precursors, and to shared action. Saldana puts this beautifully from a colleague that we learned it from, which is also when we share those experiences and then develop a kind of a shared language for it, we understand that fear is a precursor to courage.
It's beautiful.
So, I think that's a key part of this, right? And so much of the infrastructure that we've laid down is the tracks, which take years and years of work, as I think I know from the coalition's experience, from everything you've done here, are not just technical kind of solutions. They represent relationships. They represent shared experiences and shared language. You're developing a different way of operating, right? In this way. And it unlocks then possibilities. Those same kind of tracks allow us now to layer on new conversations that, as it turns out, allow us to navigate this moment together, the shared experiences, the shared language, and then those tracks unlock kind of shared actions that we can take. This is not a shift from the way we've been doing things to a whole new thing. This is building, in the archaeological kind of experience of building things together. You have layers from 2019 to now, and each of those layers builds trust and builds experiences and stories. And if we look to through a narrative kind of excavation, if we were to kind of look through that, you could probably see some dark moments and some times of fragmentation, but there's also these moments of convergence. There's moments when different organizations in your coalition came together, perhaps as a coalition, you all came together. There's these moments you can see it in the archaeological record of your story, right? Of strength. The shared experience and shared language, I think, allows us to kind of uncover those things together and then say, now, how do we continue now to realize that we're just building new stories together, and those stories beget action. So that's my thought, Heidi, here. I think that
Thank you.
the currency's there, the language is there, right? The relational kind of trust is already there. And I think with that shared experience and shared language, you can start, and the shared experience actually taking action together now, but get other ones. I've been talking a lot about morale, momentum, the challenge that you guys have been experiencing from my understanding, and how now there's concrete skills and strategies there. I will also say, if there's interest to talk about money, also happy to talk about that, because folks who are wondering about the other set of challenges about sustainability, it turns out the shared experiences, shared language, and shared actions to build power also lay down the tracks for being able to understand ways to share financing and unlock new sources of capital and align capital as well. So in future conversations, happy to talk more about that, because it turns out there's a very concrete set of skills and strategies there. And I think you guys are well positioned already to be able to think about ways to move from the grant funded dependent kind of model to now building on that. Other ways to share financing. What does a regional care coordination fund look like? How can you create the financial backbones to build on the backbones that already exist now to help to coordinate resources there and avoid or minimize the free rider problem, the wrong pocket problems that exist. The collaboratives that exist around the country, like yours, that have laid down the infrastructure for service continuity, right, are also now positioned to think about collaborative financing kind of strategies as well, to unlock not just the power part, but the financing part. So if that's of interest to anybody as well, to not just build power, but to unlock financing and capital, we're happy to share notes from other collaboratives and some of the skills and strategies that we're working on too.
Yeah, for sure. I know that would be of interest, and it seemed like these would go together, right? The financial part and the
money and
power.
power can go together. Exactly. Exactly.
Yeah.
Exactly. All right, guys. Lots of love to you. Please say hi to Derry Ashford, Daily Church, and to Kennedy Elementary, Holland Middle School. If there's anybody in this group that knows those areas, please reach out to me. My email is, if it's not in the chat already, it's here. I thank you all. Lots of love.
Thank you. One of our nonprofits is working. They texted me while you were speaking at Kennedy, Brighter Lights. Yeah. So.
By the way, so we want to work with all of you. We want to support you whatever way we can do. So just know, like, Houston, we're coming. Please invite us. Let us know how we can
welcome you with open arms. How about that?
We'd love to work with you guys. Bye, guys.
Thank you.
Thank you. Sadhna, thank you so much for staying on. I know, given your policy, extensive policy experience, can you speak a little bit from that perspective as well, in terms of engaging legislators and sort of that piece of the conversation, and how does that dovetail into the financial side of things, in terms of these efforts being supported through state funding? I don't know. I'm just trying to think of like where those dots could potentially connect. And thank you for taking a few minutes to stay on as well. And you're
No
welcome to
worries.
stay on the whole time.
Yeah, I'm happy to stay on the whole time just to learn more about
Yeah.
what the coalition's doing and your successes. So excited for that. I also wanted to speak to the last question that was brought up about some of the bright spots, because I think there's this through line to the question you're asking now, which is really that these collaboratives and coalitions and groups of people, it's similar to what Rishi was talking about in the like storytelling and the kind of archaeological dig of your individual story, is that there is this important moment that's happening right now. And the bright spot for me is seeing how groups of individuals, groups of institutions are responding to that and seeing that power and the trust that you've built over the last few years and using it for something even larger, right? And it took a number of years. It's going to take a number of years if someone were to start a collaborative today to be able to build that trust and kind of ease and negotiate the hard conversations that need to be negotiated between institutions, between individuals to make meaningful impact. And so a bright spot is really seeing folks rise to the challenge and say, look, we're going to do this and have difficult conversations about policy, which may benefit me, but might not benefit you. Or the funding streams may mean that what we've viewed as a kind of closed pool can actually be expanded. Those are tough conversations where you have to really identify your own self-interest, be comfortable naming it to someone else and sharing it with someone else, and negotiate that conversation. This is one of the skills that's relevant for building solidarity within a pro-democracy movement, because it requires us to show up in a different way within a traditional system that's told us that there are winners and losers and it's a zero-sum game. And so having that conversation is different. And I think on the policy side of things, this is where true power comes. So when I was in the White House, when I was in the Department of Health and Human Services, I interfaced with community organizations, and the most powerful were when they could coalition build and come together across unlikely allies, across sectors, and say, we're all going to stand behind this thing, or we're all not going to stand behind this thing. And so you should know that if you're going in this territory, there's going to be a real problem. And so I think that's the thing that gives me goosebumps in this moment, is that I see this happening increasingly across collaboratives, where they're feeling, yes, we can have greater power together if we open these conversations up, learn how to talk to each other about these things that have been a little bit like money and like power, that have been a little taboo, and use it in more of a public facing way, meaning when you're talking to legislators, when you're talking about policy change, and moving forward in that way.
Thank you, Sadhna. Any other questions? If not, maybe Heidi, we can move forward with our other, and if you have questions for Sadhna, please put them in the chat. She'll stay on with us.
Yes, let's go ahead and jump into our work group updates. So quick reminder of our agenda, right? We started with the Health Begins team, then we're going to talk about the updates from each of the work groups of the work that's underway, and then we're going to spend some time working together as a large group on our charter and our charter refresh. So be thinking about that in your as we're going through these updates, in that we're at this time where we are refreshing. We have a new name. We've got a great team you're seeing here of our steering committee members, of representation across diverse organizations. And what is our path forward together as we look at the work that we've accomplished and where do we go? So let's go to the next slide, Wes. And I'm gonna, for those of you who are new, here's just a quick reminder of the structure of our coalition. You've got our work groups and task forces there. Each one has a group of co-chairs that the co-chairs sit alongside the backbone team and form the steering committee. And we take the agenda from the work groups and the members and coalesce that and bring it together in the steering committee, and then really build the shared strategies out across the coalition and kind of connect the dots across what are the priorities that come up for each of our members. And what is the value of coming together in coalition work? And that coalition work is distinct from organizational work. It's a unique opportunity. Let's go to the next slide. And I believe we have our policy team up first. So I'll pass it to Jordan and Iris to take it away of the updates of what's happening in the policy work group space.
Thank you, Heidi. Yeah, just feeling very grounded and energized. Sadhana, from yours and your comments and Dr. Manchanda's presentation. And funny that we're first because y'all are talking about all the policy work right now. So my name's Jordan. I work at Prevention Institute. We're a national public health organization, but I'm based here in Houston and been with the coalition since 2020. And Iris is at a conference. She's doing too. She still wanted to join us. She didn't want to miss. So I don't know if you can say hi, Iris.
Yeah, hi everybody. I'm happy to be here and such a great way to start this week. It's very inspiring. So yeah, look forward to this.
Thank you, Iris. Yeah, so just to remind folks, or if there are new people, you'll see there are our policy work groups priorities. We have also been really through Dr. Sharma and Heidi participating with a Texas Foodist Medicine Policy Work Group convened by CHLPE, or the Center for Health Law and Policy with Harvard and UT Health. And then we've also launched, because of conversations that were coming up in our monthly work group, we've launched a new subgroup that honestly came from a lot of the conversations that have already happened this morning. It was kind of a coalescing of things. It was the anti-authoritarianism, pro-democracy conversation. How can we do more as a coalition that, you all have been discussing? It was also around the harms to immigrant communities with ICE presence. And then it was also around everything that some of the, smaller CBOs and grassroots organizations that are part of the membership that maybe don't have that money and power that you all are discussing, and in the same way as some of our larger healthcare institutions. So it was kind of like, how do we build that power on those issues and give people more advocacy and policy change capacity. So we're still figuring exactly that. We're figuring that out still a little bit as a sub work group. But yeah, stay tuned for more on that. And then we have some opportunities right now. We wouldn't be the policy work group without some action items. So today, Monday, May 18th, is early voting begins right now. So you could vote today if you so choose. You can also vote through the end of the week. And election day is Tuesday, May 26th. Now, this is for our Texas primary runoff. I live in District C and also in so many runoffs. There's been so many runoffs, so it can be a little confusing and what are we voting in right now? So this is the actual primary runoff. So if you live in Harris County, you can vote anywhere in Harris County during early voting and on election day. And this is a reminder of something that's kind of also policy wonky, but we have party primaries in Texas. I think you all already know that. So you either voted in a Democratic primary or Republican primary. So if you already voted and you voted in the Democratic primary, you do have to vote in the Democratic runoff. If you voted in the Republican primary, then you have to vote in the Republican runoff. However, if you didn't vote in the primary at all, then you can choose which runoff you vote in, and you're still eligible to vote in the runoff. So any questions around that you can put in the chat. And then shifting over to state, the Texas legislative interim session is happening right now. We wanted to also put a little, I'm going to pop in the chat the bullet points that we have on, or Iris just put some of the election things that we have there, some resources. But we also wanted to give you some quick tips. I don't know, Iris, if you could do those too. Quick tips for signing up for alerts through Texas Legislature Online.
I put that in.
Okay, awesome. So if you have never had a Texas Legislature Online account, that's what those tips are for. But we have different Senate and House committee hearings right now. Sometimes those interim hearings, interim meaning like we're not in a legislative session right now, we're in this in-between year, but there's still a lot going on and your voice can influence like what might be discussed in the legislative session. So sometimes those are invited testimony only, and sometimes there's public testimony available, but you can't necessarily travel to Austin. It doesn't mean that you can't advocate. You can still email and call your representative or the list of people who are on that committee. And then we're going to give you an example because there is one coming up in the health space. And Iris is putting that in right now. So on Wednesday, May 27th, Senate Health and Human Services will meet. And then that first link is who's on the committee. So that's always important to know the who. And if you can't, physically testify, and there's something, or actually, sorry, this one's invited, so you can't, but you can still, reach out to the people on that list if there's anything on the hearing notice that you're interested in. And that second link is the hearing notice. And then lastly, we only have 5 minutes. I'm like, and this is we just had an hour training from Dr. Lynn Cowles, who's at Every Texan. She just came and talked to our work group. And even that, she talks faster than I do and she got a lot of information in. But essentially, we are under a sunset advisory commissions being reviewed. So sunset review is basically the process to evaluate the function of every Texas agency. Sometimes that agency's work is no longer needed. And some of the agencies are very important that are under, tons of them are under review, but to give you some examples, Health and Human Services is under review, Department of State Health Services, Department of Family and Protective Services, Texas Juvenile Justice, Maternal Mortality and Morbidity Review Committee, and Texas Workforce Commission, and more. And there is still an opportunity to get involved and advocate right now. According to Lynn, they're still taking input throughout the summer. And Iris just put the first link is the public input form. So that can also be passed on to anybody, any community member you just click on the agency that you want to make a comment about and then put it in there. I will say the biggest tip around comments is that the sunset review doesn't inform funding. So saying like more funding for this program or more staff allocated to this program, it's just not the place for that kind of advocacy because that's just not what they do. But for an example could be like, I do this work in the Houston Health Department, and I think we need to have more cross-training between the community partner organizations we work with and HHSC staff on this and why. So those are the kinds of things that they will take into consideration. Yeah, that's all. Any questions or thoughts on any of the things that we just so quickly shared? Iris and I will be in the chat for a little bit.
Thank you both for your ongoing guidance and expertise of navigating policy changes. So appreciate it. Let's go ahead with Melanie and Maria in the food security work group.
Yeah, Yes, good morning, everyone. Well, lots going on in the food security work group. Obviously, this work group, I want to just say, has grown tremendously. And I think one of the big things that we've identified through this opportunity is the intersection around so much of our work, both in the mental health space and the policy space, that is having a direct impact on food security. And so a lot of conversation about how that's driving that. We've also really been able to leverage a lot of key learnings through research that has been done specifically around facets and areas of food security. So the food security work group has 3 sub work groups. The stigma sub work group has really benefited from some of the research findings from Dr. Karpin, which talked about stigma. And the opportunity here has really been to think about these key learnings and where we go from here, I think, is the real opportunity question. This group has explored stigma from numerous facets, from both place-based approaches, how screening may be a consideration when we think about stigma, and then also not just from the recipient's perspective, the patient's perspective, but from the provider's perspective. We have such a great, rich group of individuals in our work group that come from the healthcare lens and landscape who also have shared some opportunities here. The second really subgroup has been around the landscape scan. And this has really allowed us to take a step back and think about collectively what the types of services and programs that exist in our ecosystem across various communities, where things are represented and where things are not. And what I love about what's been happening with this group specifically, and it was mentioned earlier about the power of coalitions, is alignment on language. And so because of the rapid emergence of so much of food as medicine work, there's been a real opportunity to really think about better definitions of some of the provisions of services. And through that alignment, we're better able to understand the type of intervention strategies that exist in communities and have a shared language. And so there's been a lot of work, co-creation, pulling on also some, language through organizations like FIMIC, American Heart Association, to really make sure that we have a shared language around the type of food as medicine interventions and then where they exist in Texas. So, and then policy has really shaped a lot of our learning series, which is a third subgroup here. There have been numerous, as Jordan and others have mentioned, there's been numerous active policy updates occurring, and the impacts of SNAP, HB1, HB25, a lot of the food as medicine work that's continuing to be shaped in this space. And so the learning series has really allowed us to, pull from subject experts in our communities to really understand what should our group be considering as a result of these policy changes, and where are there areas that we should be considering in both our advocacy strategies and as well as how these changes are impacting people in communities. Finally, I'll just highlight that there's been opportunities for us to try to get together. I think we want to do more of that in the upcoming year. I think there's been a real desire to, as I mentioned, this group has grown, but really be able to put this work into practice. We have so many great organizations represented here. And so to be able to see this work in action is truly instrumental to really gain and bridge understanding. I also want to call out some areas that, have lend themselves to this workspace that we think that can be continued to be enhanced in our conversation. Through through the Care Network learnings, we have been working with several healthcare partners to look at the closed loop referral approach. And referrals are definitely an area, and service coordination was mentioned earlier as a really important area of how coalitions can work more seamlessly together. And so we have identified this is an area that we really want to, as we've kind of evolved some of our groups' understanding, as we've met some of our deliverables from our initial subgroups, that we really feel like is an important space to continue to incorporate into this work group. The Care Network learnings is really a build around some conversations that occurred in this work group, as well as really thinking about the system integration aspect of healthcare and social care. And so this is an area that we really feel like we can begin to think about scalability, and certainly about learnings as it relates to how to implement and put into action some of these policies that we see up and coming. Finally, policy is always, this is the food security work group, but certainly we can't do this alone. And so policy is an area that we really want to make sure that is front and center in this space around how policy shapes program provisions. And this is critically important to think about how we move from, as mentioned earlier, grant funded to more sustainable approaches in our area and in our communities. So this is an area that we will continue to pay attention to, particularly as the provisions of programs like SNAP and WIC are being discussed at this time. And then finally, as I mentioned earlier, we have some wonderful organizations as part of the work group. And there's an opportunity to make sure that the learnings from those organizations are uplifted into this work group as well. We have healthcare providers doing incredible work. We have CHWs that are incorporated into some of these areas around screening and referral work. And so really the shared learnings in our group itself around what they're hearing and what they're seeing continue to be an important aspect of that. And so what that looks like in practice is we've been able to do a couple kind of smaller, more intimate conversations around key areas to really hear from others in terms of what are the areas that this group feels are important to uplift. And that really helps inform our learning series as well. So really looking forward to kind of reshaping and growing those subgroup goals as we navigate this new environment with policy coming up ahead. So Maria, if there's anything else I've missed, feel free to jump in.
No, you did such a great job. The only thing I would add is, and thank you, Melanie, for summarizing that, is one thing that I hear you and Jasmine say a lot from the Houston Food Bank, that food is the ticket. And when we think about food, we all eat food, and it's part of our culture, our day to day. And so we just continue to have that as part of our like basis for the work that we do, because it ties everybody. And it's easy to understand. And it's something that can be messaged in different ways to get support. So thank you for all the work that everyone does for in supporting us in this food security work group. I think the next slide. Go ahead.
Go ahead, Maria.
No, I was just going to do your part. So.
Please. No. Let's go to the next slide. And thank you, Melanie and Maria, for your leadership in the food security efforts. I'm going to go ahead and stand in. Lisa's not feeling well, and Dr. Williams is at a conference. So I'm going to stand in for them and share what's happening in the mental health and substance use work group. Some of the highlights of the work that we have been doing is building on that survey that we did last year around what was happening in the stigma reduction space. We identified 37 different tools that are being used in different ways, and really distilled, and kudos out to Dr. Williams, he kind of consolidated things into a toolkit for organizations in our region to use. There was a lot of interest. There also was a lack of standardization and understanding. How does stigma come up within workspaces, as well as what are the opportunities of really addressing that and building more caring and welcoming organizational cultures as we're serving communities. And so what we're looking to launch right now is the community of practice. We're thinking about 10 organizations, similar for those of you who are involved in the CHW employers learning and community of practice in 2024, really to pilot some of these tools, to learn from each other as we're implementing the tools in our organizations, and probably refine the toolkit a bit more before sharing it out broadly. So a lot of shared learning. And in that process, there's a lot of interest. And I'm not sure ROI is the right word, but this is the way that it's coming up within the work group of people really interested in understanding what is the value and how do they position stigma reduction as a valuable effort to their leadership within organizations. And part of that messaging has been talking about the linkages of addressing stigma is actually getting to the core of employee burnout. And I would say, perhaps even going back to some of the conversations that we started with Dr. Manchanda of moral injury. As a part of that process, wanting to get back to the journey mapping and create a journey map of lived experience in encountering stigma and caring in accessing care and services across our region. And then finally, when we look at accessing services, I think it's not news to anybody here that there is a lack of mental and behavioral health services in our region as compared to the need. And very exciting new facility at 401 Emancipation coming online now. The Harris Center is really spearheading what sounds like a collaborative effort in bringing online a really exciting new facility. They're going to be doing a learning session with the coalition June 17th, save the date, invitation coming soon. I'm really excited to learn more in that space. And with that, let's go to the next work group and do welcome any comments or questions in the chat as we're going through these work groups. Let's focus on community voice. William, Sandy, and Kyle, please share what we're focused on in this work group.
Hello, good morning, everyone. So the last couple of months, we've been focusing on setting the vision. So we've, networked with some of the other work groups and realized that we had a vision in our head, but we had not written down on paper to kind of help focus our efforts. And so that is what we've been working on the last couple of months. And we will be, engaging work group members to kind of finalize it, hopefully over the summer and be able to roll into engagement in the fall. We've been continuing to do community engagement activities, so going to different work group meetings, going to different focus groups and summits to really kind of get the landscape of Houston and our region, and really thinking about how do we practice what we preach, right? So you got to show up to then be able to strategize how we can show up for community members. Looking forward, we're looking to develop a framework for our networking sessions. So we're planning a few network session series and really thinking about how do we, activate and bring to the table regional leaders and experts, develop resources and toolkits for member organizations to kind of use in their efforts, really trying to maximize translation of evidence-based toolkits and things like that, and really centering all those things on community engagement. And then lastly, we are working on, I guess you could say, a one-pager on living conditions. So recognizing that there are some things that take away or distract from community engagement, and how do we acknowledge that, but then also come back to the table to kind of help strategize with community members and organizations to make, civic engagement, making sure that people have affordability and stability in their lives, and also addressing those neighborhood and environmental conditions that we all live in.
Oh, no.
Of course. Yes, yes. And with that, I turn it back over to you,
Oh,
Ivy.
no.
Thank you, William. I think somebody was off mute. And thank you, Kyle and Sandy as well. Let's go ahead and go to the next work group.
All right. Hi, everyone. I'm Wes Gibson, one of the communication co-chairs. And so, yes, as you all know, we have had a name change. And so, Alicia, I know I'm speaking, but Alicia had a huge role in really helping with the creative aspect of this, of helping do all the groundwork to develop the new logo, keep our branding standards with this new name change, as well as a lot of the UT Health Houston staff as the backbone organization implemented what you all, the feedback you all gave us as we worked on this name change. So we have updated our website to reflect the name change and new priorities and goals, as well as the branded materials and toolkits. So that includes things like the slides themselves and other material we use to promote the work of the coalition. And our YouTube channel, where we post networking and learning sessions and meetings and other things, as well as our new membership database. We have Salesforce that also have to give credit because, again, I'm the spokesperson, but there's a lot of other people involved with this. Naomi Tice had a huge role in with that. We've been able to streamline our emails and other invites that makes it a lot easier on the back end. LinkedIn, and if those of you who are not following us, you'll see our handle there on that bottom right-hand corner. We now have 2,846 followers. And of that, those followers, 30% are in the greater Houston area, and 63% are across Texas. And we have other followers in other cities such as Chicago, Boston, the Bay Area, New York City. And membership composition includes higher education, CBOs, healthcare, government payers, similar to what you all saw in the previous slides about our membership composition. And on LinkedIn, we've been really been able to highlight our steering committee, Partners in Progress. It's been there's been great engagement. We appreciate all of that, but of course, our steering committee and highlighting just the membership history, the contributions they've made, and how they have a huge role in advancing our work. And then this year we've been able to have 5 virtual learning sessions and then 1 in-person connection event that we had at Axelrad in April. And I'll pass it over to you, Alicia.
Thank you, Wes, and good morning, everyone. In terms of priorities and just opportunities to get engaged, we'll continue the communications work group of, trying to increase awareness of those existing activities around the non-medical drivers of health, as well as getting more folks engaged in the work of the Coalition for Connected Care. We'll continue building upon past learning sessions, using the data available, and really being more thoughtful and strategic around partnering with our other work group leaders and the community. I'm really putting the priorities of our work groups front and center. We'll continue our Walk and Learn series, which have been really popular. We launched these back in 2023 with the leadership of Larissa Jacobs and Fit Houston. These Walk and Learn events have really brought together our membership and the community. We have fun, we get active, we network, and we learn from not only the community leaders themselves. We can see some of those disparities right there while we're doing the walks. In terms of our core partners, Fit Houston, I already mentioned, Harris Health has also been a core partner in these walks. We partnered with Super Neighborhoods and other community leaders and organizations. To date, we've completed 8 walks, and we have 2 upcoming in 2026. The first is our annual Walk and Learn in Kashmir Gardens, and so this will be our 3rd year completing this walk. Thanks to many of the community leaders, including Mr. Keith Downey, who's just been a tremendous advocate of this work and really helped bring those community disparities, which I mentioned before, to light. Next up, we have our Setagast Community Walk and Learn. This is currently, in planning and development, but we have established a date. I just want to thank Kyle Maroney for his leadership and vision and connections here. And then we, of course, want to encourage people to get engaged. Wes already mentioned our handle, Coalition for Connected Care. So you can get on LinkedIn or Instagram, or just type that in your web browser and all of our channels should pop up. We do monitor the engagement on these channels, that we use that along with our work group priorities to help inform the work that we're doing. So we definitely encourage you to get engaged, share your voice, and look for ways to get involved. There's plenty of opportunities which we've covered here, and then we'll cover at the end of the presentation as well. Thank you. Back over to you, Heidi.
Thanks, Alicia and Wes. One more shout out of, we so appreciate your leadership and design expertise in the rebrand. It's just a beautiful build on our prior brand. And a quick photo. This was a really fun time coming together. Stay tuned. We'll have more networking in-person sessions coming soon. And Rosalie, I'll pass it to you to talk about the work underway in the CHW network.
Everybody. It's been great listening to everyone, of course, the presentation and listening to everyone's updates. My update is on our Community Health Worker Network. It's interesting because, of course, upstreaming is everybody's job. Everybody who's on this call, that's their interest, and works so hard every day to really work, towards building a better community and society. But a lot of this work depends on a workforce that is, community based, community placed, people centered, and in our region, a lot of times that means community health workers. So it's been great working and we've been very busy working with the Community Health Worker Network, and of course, all the partners who are allies, employers, community health workers as well. We get together once a month. If you've been in any of the meetings or have community health workers as part of your teams, you know that it's been a rough year, right? There's just been a lot of change. Whenever there are priorities or policies that shift away from social determinants of health, because community health workers, it's basically their job. They are not clinical, they're not clerical. They really just work with people and getting at their social gaps that are, keeping them from being in their best health. So we've been really tracking these changes and working with others, not only here in the region, but around the state, to try to highlight, support, inform around what these changes are and what some of the stressors that this workforce has been under this last year and will probably continue into the next. Hopefully the legislative session will bring some relief, and of course this working in coalition and with our state partners. I think there's been some positive movement, but just to quickly go over the 3 main drivers of the stress has been the certification changes. So for those that are new or from out of the state, community health workers are certified in the state of Texas. We've been certified for 25 years, and it's been pretty steady all this time. I don't know why, in a very chaotic year, the state decided to go ahead and revamp the rules and guidelines around certification here in the state, which impacted the entire line of a pipeline of community health workers, all the way from the training centers to the employers to the community health workers themselves. So there were significant changes in the certification process. And as you can see here, it's the first time there's been a change in 25 years. And this change was taken during a time when the state lost a lot of funding. So now the program that is implementing those changes is extremely underfunded and under manned. So yes, it's been difficult. A lot of our training centers, including ours, are sitting on the sidelines right now while our these changes are happening. We're trying to submit everything that the state is requiring of us as training centers. Of course, at the same time, we're going through sunset review because the program for community health workers certification program is under DSHS, and DSHS is the is the program, the department that's under sunset review. So that has caused the priorities to shift for the staff at DSHS. They've really had to focus on the sunset review, further undermining their attempts to support community health workers and training centers. And then, of course, on top of all of that, is because sometimes stress is good, right? So for the first time, but this is not in this past legislative session, but the legislative session before, for the first time, there was some policy that was passed at the state level, which allows for reimbursement of community health workers, which is great. It was a time to celebrate. However, anything that has to do with money or reimbursement, it takes a while to actually implement it, and it means kind of ironing out a lot of kinks. So along with the policy committee and the community health worker network, we've really been trying to get into the weeds and figuring out where those kinks are, right? Where implementation, if there's any kind of bottleneck somewhere, we're trying to work collaboratively, because the idea is not to really call anybody out, but to work together to figure out where the bottlenecks are, and then try to work on those together. So I think it's everyone's consensus that the rolling out of some of these reimbursement policies, the actual implementation has been kind of slow, but in the world of policy and legislation, slow, it's a very judgment. It's a judgy word. Who knows what slow is, but for especially during a time when programs are looking to keep their community health worker programs, because unfortunately, when there's loss of funding, it's usually these types of workforces that are let go first. So it's been a challenging year, but I think through the network, we've been able to keep ourselves informed, keep our partners informed and the coalition members, and then more importantly, give some place to put people's energy. Right. So again, working with Jordan and Iris, and the other working groups, we've been able to come up with ideas, who can I call, who can I write, what can I do? And so everybody's been really great in there, have been really engaged around our keeping up with what's going on, and also putting their energy into providing some feedback to the state, and also doing things within their agencies that support community health workers overall. Heidi, my my co-lead here on the network, we work very closely together on this. I don't know if there's anything I missed or a gap in there. Thing you'd like to
No,
add?
I think you did a great job, Rosalia. I'm really excited about the landscape scan and the opportunity to build even further together with this. So for those of you working in the CHW space, do watch for that coming out soon. Thank you, Rosalia.
Yeah, it's interesting because we just had a conference at U of H on Friday, which was on research. And one of the things that we were really talking to community health workers and employers is that it's very important for people to participate in surveys and in questionnaires dealing with the workforce, because the people who fill those out are making decisions,
Yeah.
because we're going to use that data to say, okay, this is what we're seeing out in the community. So I think everybody got that message. So
Yeah, thank you, Rosalia. All right, let's move from the workforce to the technology and data sharing capacity, building on what Melanie gave us a sneak peek of in the food security work group. Kudos to her and William and Dr. Williams and Sandy for really helping to spearhead a lot of this work, and then the team at Memorial, of course. So the CARE network, which we envisioned together of how to connect our systems that exist to allow for improved access to care and services, is up and running. This is the way that it's configured. You can see our healthcare organizations. It's linked into the master patient index of our regional health information exchange with a master patient index of about 24 million lives. And then connecting into the Houston Food Bank's Community Resource Hub, which has over 1,600 community-based organizations. And you can see the service domains we're focused on at this point in time: food, housing, transportation, and financial needs. This allows us to track and understand where the referrals go and the response back from the patients and connecting them to care. It's been a phenomenal learning journey, I would say, because not only are you connecting the technology and the data, but we're connecting the workflows of how organizations do their work across the work. So let's go to the next slide. So just kind of to recap, the biggest piece of this work is the governance of how do we work together across organizations, then building the technology connections to allow that work to happen, linking to a validated resources directory, and really the work that the food bank already has done in this space, and then being able to track, evaluate, and develop the sustainability strategy. We're really excited that at this point we have a 69% success rate in closing the referrals, the closed loop. And so that's with over 1,000 referrals, serving as of Friday, 587 patients. And this is compared to not only our region's average of a 50% success rate, but also that's pretty close to the national average. Let's go to the next slide. If you can click through, Wes, I don't know why we have animation here, but we do. And so we have our alliteration of C's here with our lessons learned. Really, the key is the collaboration of governance drives the technology and the way we work together, and aligning the benefits of each of the organizations. Dr. Manchanda talked about that a bit as well. And that extends from, does this work? That extends to the culture around this as well. So does this work for my organization to does this work for the patients and how we're all working together. That's been a key kind of like learning and ongoing shift, as well as the capacity building across the organizations. The challenges of connecting technologies for those of you who aren't in the tech sector. Wow, they've really put a lot of barriers to the type of work we want to do. So navigating that, and huge kudos to UT Health Legal Counsel, who's helped us navigate a lot of that. And that ties into the consent processes. And as we look to better serve the community, really honing in and refining these consent processes of what is it that's most meaningful for the patients and neighbors that we're serving, and what is their agency in this process is where we anticipate some of our learning in the next cycles. I know I'm blazing through it quickly, but I want to get to the charter. Let's go to the next piece. And where we are with the activity. So the system is up and running. Like I've said, we're focusing on the outcomes evaluation. We've been doing process evaluation through that, as well as the business model. And then some of those client and patient-facing communication strategies. Melanie and I are working and pulling together like text messaging communication, because we all like text messages better than talking on the phone, it seems. And then we welcome those of you who are interested in being a part of the network to reach out to us. You can use the Connected Care texas@uth.tmc.edu email. Of course, you can always reach out to me as well. I'm going to go ahead and put the link in the chat for our overview video that goes a little bit more in depth. It's just a couple minutes long if you want to refer to that later. And let's go to the next slide. I think that wraps it up. So that is a lightning peek at the work that's happening across our many work groups. I want to pause. Sheila, comments that you want to add here? And I know Sadhna had something she wanted to chime in with as well.
I'll let Sadhna go first and then
Okay.
get through the charter.
Okay, thank you so much. And, I'll be quick myself. It's just been so inspiring to be here with you all. Rishi had mentioned how, we're huge fans of your work, and getting to sit here and learn about really what Dr. Sharma said, which is like the name changed, but you're still moving ahead with the mission, was just beautiful to bear witness to across all of these different components and work groups. And also just want to mention, with your name change, which we've seen as a necessary move for many across the country, you're not alone. And I want to pull back on the quote that Rishi kind of summarized, which is, and, not knowing, but kind of thinking through what might have incited the name changes, that we know that fear is a powerful motivator. And we also know that fear is a necessary precursor to courage. And so as you think about your charter and you're going into this part of the conversation, think about, what do you want the complete story of your coalition and this moment to be? Is this a moment when you want to make yourself smaller? I don't think so. Like, having listened to all of this, seeing all of the great work ahead, the powerful work that you've been doing, it's clear that the path that you plan to proceed on is to continue and to grow and to be more impactful. And so as you go into this charter revision, just really want to invite you into the headspace and the heart space to consider how you'll use this moment, which might be a fear, which might be a moral injury, to catapult it into your courageous moment. We're in touch with Dr. Sharma and with Heidi, and a few folks have already emailed and messaged. So just really invite you, and we're looking forward to being alongside you in this journey to the extent that we can.
Yeah, thank you so much, Sadhna. Yeah, I think all of us agree wholeheartedly with you. Those words are, I think all of us resonate with all of those words, whether it's fear, moral injury, and courage as well. I don't think Heidi or I could ask for better partners, in this work together. So which takes, I think you really framed our next conversation. We just have a few minutes, so we're going to maybe what we'll also do is leave this survey open for folks, and we'll send it out as well. But wanted to, if you want to jump to the next slide, I think again, we won't have time to go through it, but when we did a survey of the work of the coalition last year, essentially what we realized is that we've gone from the land of awareness when it comes to non-medical drivers of health into the land of doing. So actually, if you want to jump to the next slide. There was a lot, if y'all recollect 7 years ago, a lot of health systems were starting to screen for non-medical drivers of health. A lot of folks were thinking about, well, I'm screening, how do I serve them? There was a lot of that type of work, and that's the grounding that informed the charter when we developed it. And since then, we haven't actually revisited it. We've organically, every year, each of the work groups has built on the charter and developed the goals, but we haven't really revisited the charter. And it's time to revisit, because all of us are in the land of doing. There's a lot of partnerships that have been established, a lot of rich conversation, and we want to move. There's a lot of the interest in sustainability now, right? How do we move from this grant-funded world into a world where a lot of these practices that we've been engaged in move into the policy space or move into a more sustainable space? So we've gone from ideation into action, which is great, but now we need to also update our charter and our goals to reflect that. So next slide. So these are the gaps, which are also opportunities that we have identified from some of the evaluation work that we have done. Primarily that there is, most of the NMDOH programs and services are grant funded. We are living in the land of pilots. Policy supports are needed. Our existing policies, even if we have those supports, some of the implementation needs strengthening. And we need to also understand if these policies are working. So our policy evaluation is critical. And when we think about care coordination, some of that undergirding of care coordination remains weak. Whether there's a lot of competition around technology vendors, limiting interoperability, or the human capacity of care coordination, our community health workers, and the challenges in that space that Rosalia was very articulate in stating. So what does the next phase of collective action look like for the coalition, given these challenges, which also pose as opportunities, is what we need to think through. So next slide. We have, this is the link to the coalition charter, our old coalition charter. And then Heidi, how are we, there's a QR code right on the next slide.
For the poll.
Yeah, for the poll. And
it's all, yeah.
So if you can go to the next slide, Wes. If y'all can please take a moment to go to this QR code, you'll see a survey pop up, which essentially has 2 options and questions for you. We would love for everybody, so we'll give everybody perhaps 5 minutes. We'll leave this open. If there are any questions, just come off mute or put it in chat. And feel free to also link, maybe we can put the link to the coalition charter in the chat.
The link is in the charter. We've got several people
okay.
in it. already, and I just put the link to the survey. You can also do the QR code on your phone. I'm wondering, though, I know some folks have a challenge with Google Docs. Wes, maybe could I share my screen with the actual charter document for folks as they're responding to the survey?
The new one or the old one?
The new one. So the new one has refreshed goals. We have the mission statement has essentially stayed the same. We have
It's
two vision
small.
statements here. Huh?
Heidi, it's very tiny. You'll have to zoom in.
Oh, screen. And is that better? I still think it's small.
Yeah, it's very tiny still. But maybe I think Naomi said if you can provide a link to the survey in the chat since the QR code is gone.
The link to the survey is already in the chat, as is the link to the charter document. Yep.
Heidi, we're not seeing it in the chat. Can you please add it
Yeah.
again?
Yeah,
Oh,
it's
sure.
not in the chat, the link to the survey.
Oh, maybe I put it in one of the, sorry. I have a lot of DMs. Maybe I DM'd it to somebody. Are you seeing it now?
Thank you.
Thank you.
You still have to zoom in. Sorry, I don't know. Maybe it's my computer. I'll try to zoom in.
Right below that, Heidi, is a percentage. There you go.
Oh, thank you.
Okay. And we have several people in here, so thank you. So continuing on, we've got the two different versions of the vision statement that the steering committee has kind of gone back and forth with on those. The principles and the values remain the same. The primary changes of where we looked at, and this builds on what Srila was saying, of we're past the ideation phase and squarely in the doing phase, and our goals needed to be revamped to focus on that. And so we've got our long-term goals of what do we want to achieve, and then the short-term objectives of what do we want to do. And our questions in the short poll is, first, which of these vision statements most resonates with you? And then second, as we look at the goals and objectives, is there anything that we're missing that needs to be strengthened in that point that you'd like to see there? And then there's a third question of the value for your organization in coming together as the coalition. We want to be sure we continue to focus in on those value points in the work that we do together.
Maybe we, yes, I think just stay here because these are not in the survey. So if folks can just take a look at the goals and objectives. And if there's anything that is missing. The objectives are achieved in the work groups. Just FYI. Sorry, what were you saying?
I put it in the chat, but also pointing out we left a lot of the notes that we took from some of the conversations with the steering committee members on points that we felt were like we're still kind of working through the best way to capture those aspects of the work. And this gets back to some of the conversations too that we've had through the framework evaluation, et cetera, on how do we set the metrics of success? Because these objectives then would determine and follow along with the work group's metrics of success in the specific areas.
Okay, we'll give folks a couple minutes.
I think one thing that might be helpful, it might be helpful to make it more explicit. I'm looking at the bullet point that says establish the value of collaborative efforts and the work of the coalition. This makes me think about the financial benefits of coalition work when it comes to non-medical determinants of health. I mean, when I read that bullet point, that is one aspect of the value. I wonder if it would be helpful to make that a little bit more explicit. Because everybody is struggling right now, right? And they're thinking about how do they increase their capacity. And in terms of moving from like the me versus you mentality, can we move toward a let's do this together mentality so that everybody benefits?
So it's fostering intentional collaboration from a funding standpoint.
Yeah. And
Yeah.
I don't know how general we want to make this document versus how much detail would be helpful, but that's something to consider.
No, I think the objectives, definitely we want them to have a certain level of clarity, right? So that they can be operationalized across the work that we do. So, yeah, great call out. Thank you.
Yeah, agreed. Thank you, Sadhna.
Another thing that strikes me is that sometimes, well, we know that different organizations are on different points in the journey to collaborative work. And, it would be great to help organizations understand where they are on the journey and how they can plug in wherever they are. Because it might be overwhelming if you have no idea.
The journey for what? Could you say a little bit more? I'm not sure I'm following.
Well, I mean, I guess there's I'm seeing several different factors, depending on the size of your organization, the capacity of your organization, and how much you know and buy into the idea of collaborative work. There are different ways for you to plug in, right? And different ways for you to understand your role in this bigger picture. And so, if I'm a small organization with little capacity and don't know much about this coalition work, what is my next step? Versus if I'm a larger organization with more capacity, but little understanding, what are my next steps? And so the idea of helping people understand where they are and what they can do in that moment to get onto the train, I think would be helpful.
Yeah. I mean, I think this is a part of the reason, the part of the purpose of the charter.
And so
So
where does that, which bullet point is that?
I would say we start with the vision and mission of how we do our work, and then looking at, okay, well, what are the goals? Where does this align with the work my organization is doing? And which of the work group specific strategies? Because a lot of this is like what we want to do across the social determinants or living conditions. Does that get at what you're asking?
I think June is stating something that's slightly different, but maybe just in the interest of time, June,
Yeah.
would you mind going into the document and making a comment or sending it to us? I think we can make sure we reflect that as well. But yeah, Heidi, do you want to close us out?
Yes. Let's go
We have
back
one
and
whopping minute left.
I know, right? Wes, can you put up our next step slide? So we do have a few upcoming events, and a huge thank you to Health Begins, Dr. Manchanda and Sadhna. Thank you so much for being a part of this. We really look forward to next conversations with you all. Here are some of the upcoming events. You probably heard some of these before. More to come, but we've got a few walks after the summer, our June learning session, and others in the work. But we do have our holiday giving back session already set. And then we're looking at the dates for our fall coming together. That will be an in-person. And we have a collaboration with the Non-Medical Drivers of Health Consortium in the center here at UT Health for the Food is Medicine Conference. So some exciting events coming up as we look to the rest of 2026. Encourage you all to join in the work groups. Please do take some time to respond to the survey. We'll follow up with the recording and the slides later today, as well as a link to the survey. And then we also have we can share out the results so you all can kind of view how things are coming along in that survey as well. And thank you all for sharing your Monday morning with us. Really appreciate it.
Thank you, thank you. We'll send the recording out. Bye, everyone.
Thank you.
Thank you.